someday the bear eats you, and unfortunately I've been the snack food for a while. Can everybody see my screen and hear me okay?
Yes.
Yeah, you're good to go.
Perfect. Okay. Alrighty. So Colorado is holding their own. You can see that we've plateaued here in our cases. We are still well above where we were this summer, but certainly significantly better than we were over the holiday season. So, you know, not bad. Not fantastic, but not bad. If you look at our positivity rate, it's also plateaued here. It's about 3.5%. So that's 3.5% of all tests that are done are positive. You can see there's a significant decline in people who are coming in getting tested, and so you always have to keep that in mind when you see a decrease in the positivity rate. But certainly it's you know, it is what it is, but it is better than it was in December. If you look at the incident rate, Colorado's getting lighter all the time. So if cases per 100,000 are better, and so Lake County, you know, is no longer dark brown, which is great. You know, I imagine that when we see our influx of tourists here over spring break, that might darken a bit. And then as, you know, the tourists come in the summer, certainly they'll bring COVID with them. But it's certainly better than it was. And like I said, we're going to go with that. The hospitalizations have also plateaued. There's a little bump here, but maybe that will just continue to be flat in weeks to come. But adequate hospital space within our sister hospitals on the Front Range. And so ICUs, fortunately, have lots of beds, which means that there are less sick people. Deaths in Colorado continue to plateau as well, as you would imagine with the, you know, decline in tests. They're going to mirror one another, and then, you know, hopefully we'd never have a repeat of what happened over the holiday season again. Our Lake County data, very similar to what you've seen here, where the number of cases are decreasing. And so there are lots of little spaces in between these peaks, as you can see. And that tells us that there are some days where we have no positive cases at all, which of course is a good day. So we are certainly headed in the right direction. Looking at our positivity rates are here. They continue to decrease as well, which is awesome. So looking down at our red line, it continues to, you know, follow what the curve is doing for the state. And then one of my favorite flat lines is great as well. So, you know, looking at what we can do to keep, you know, our number of positives here in Lake County down is fantastic, but our curve is very flat these days. Hospitalizations continue to not be an issue. You know, we are taking care of our own here at St. Vincent's. There are a smattering of COVID hospitalizations, but we actually haven't had a hospitalization here at least for a week now, which is also good news for us. Our summary slide, total tests, you know, continue, as we had said, to decline a little bit, but certainly our total positivity rate since we started this over a year ago now, 10.7%, where we are now 7.5%. This number continues to decline, as you've all noted over the past several weeks. Colorado, 3.4%, so we have a little ways to catch up with them or decrease with them, but we're certainly better than we were several weeks ago. And then I added a new slide about our vaccination activity because that's such an amazing feat that we're able to accomplish here in Lake County. 2,800 doses between all 4 access points here in Lake County. St. Vincent Health, Safeway, the Public Health Department, and then Rocky Mountain Family Practice. And so we are working in concert with one another to vaccinate. Remember that we all have the 2-dose vaccines. So the Safeway, of course, has Pfizer, and then the rest of us have Moderna. You need 2 of those in order to be fully vaccinated. So you always have to divide this number by 2, essentially, if you're looking at people, bodies, you know, individuals, as opposed to just shots. But whatever it is, it's a great number. It's high. We estimate that we have about 12,000 vaccines to give for people who are eligible if everybody wants one. which hopefully everybody does. So we're, well on our way to that 12,000 mark. As you know, President Biden is making a promise that by May, everybody who wants a shot should have access to it. And we are well on our way of getting that done here in Lake County. Currently, as of today, the 17th of March, people who are greater than age 60, people who have 2 medical conditions, and then of course, everybody who we've done before, all healthcare workers, frontline workers, those people. We're also doing people in agriculture, so all the grocery store workers, and then people who work in farming and ranching are eligible. On Friday, we open it up to everybody over 50, and then people who have just 1 medical condition, and then of course everybody who's above that. We also will be able to do retail, which is all of our people on Main Street, and manufacturing, so the mine, and assuming we have enough vaccine, but that's what we're opening up to. We'll probably hang out there for 2, maybe 3 weeks, and then sometime in April it'll just be free for all. Anybody who wants a vaccine should be able to get a vaccine here in Lake County. We're waiting for the governor to give us the go ahead, and of course the supply is important. So if we don't get the supply, of course we can't administer vaccinations, but right now our supply is pretty darn good. The Public Health Department believes that on starting Wednesdays, March 24th, they will have a mass vaccination event. Similar to what they did with the flu vaccinations. The places to yet to be determined. Colleen is figuring that out, but that will help us significantly, knowing that we'll have 400 to 500 vaccinations given in a day through the Public Health Department to get to our goal of 12,000 folks. So a lot of information. Are there any questions for me this morning?
Guess they asked them along the way.
Awesome. Well, we're doing great, folks. We're almost at the finish line. Keep your mask on when you're in public. Make sure you're washing your hands. Obviously, if you are around other fully vaccinated people, you can go without your mask. But that means that everyone has had their Moderna vaccine or their Pfizer vaccine plus 2 weeks. So their second shot plus 2 weeks. And they're still recommending, smaller groups, but it's enormous benefit to getting your vaccination. So please encourage all of your friends to come get one.
Very good. Thank you once again, Dr. Lisa, for all your work in this, keeping us informed regarding COVID.
Yes, one commercial for me is I am out of town next Monday. I'm going ice climbing with the kids in Uray. So I will not be available for our weekly meeting next week, but I will return the week after.
All right. Well, thank you for the heads up.
Yep. Thank you, guys. Have a good day.
Glad you're getting
time on the
away
slippery
from
slope.
time.